biggie. Smooth versus textured implants, a biggie. How long you got? How long have you got? Right, well, right. I have here a prop. This is a textured implant. Can you see? Bit rough. I haven't actually got a smooth one. Got one in the clinic, but I've got one here. So textured implant. So we're talking about breast implants here. We used to just use textured implants, and polyurethane implants are in the same group as textured implants, or rough implants, if you like. The surface is rough, and they're rough to break up that scar tissue that forms around the implant, to make them less likely to cause capsular contracture. So as I say, polyurethane is the best because it's a three-dimensional structure. Textured implants are trying to mimic polyurethane by making it a bit rough to try and break up that scar tissue so it doesn't form a sheet of scar tissue around the outside. So in those terms, textured implants are better than smooth implants, which are just like glassy smooth. It's like a marble, because the scar tissue forms around a smooth implant. It's more likely to go hard and form a hard shell around the implant. So basically, when they first made implants, they made them smooth, and then they evolved them with texturing to try and reduce the risk of capsular contracture. Why the question, you might say? Well, the question is because smooth implants are coming back in now, and I wonder if this is why Helen's going from polyurethane to smooth, because smooth implants are now coming back in, and some surgeons are using them more, and some countries have banned textured implants because of ALCL. ALCL is a type of cancer associated with implants. It's a very rare cancer, so it's obviously cancer, big emotive term. It's a very rare cancer, and it is curable, to put it in some perspective. So the risk of ALCL is very low, and if you were unlucky enough to get ALCL, the risk of curing it is very high, usually by removing the capsule. It's a cancer of the capsule. To be honest with you, the numbers are so small, we don't really know a huge amount about it. There's a lot of research going on about it, but it seems to be related to the texturing of the capsule, of the implant, the roughness of the implant. And it used to be that there were no cases with smooth. There are some cases with smooth now, but it's a lot less common with smooth implants compared to textured implants. So on that, it's a bit like the GA in LA with the gynecomastia, pros and cons. Smooth implants are less likely to cause ALCL than textured implants, but more likely to cause capsular contracture than textured implants. Balance. Smooth implants don't really adhere to the tissues. You can't get teardrop shaped smooth implants because they just move all over the place. They don't adhere. So there are some bad things about smooth implants. As I say, that's how they first made them, and then they evolved into the texturing and the polyurethane, but they're less likely to cause ALCL. So a lot of people feel happier with that, and that is fine. But as I say, it's about informed consent. It is about weighing up the pros and cons and being realistic about the pros and cons, because realistically, you've got to be aware that the risk of ALCL is extremely small. But if you would feel more comfortable, then you should have smooth implants. I would say, personally, I think we need to tell people put it in perspective and give them the perspective of risks, because at the end of the day, we deal with risks all the time. They looked at the risk of going skiing and driving in a car, and it's similar. Your risk of dying from going skiing for a week is more than your risk of having textured implants for life. But people wouldn't think twice about going skiing for a week, even though we know in the back of our minds there's a risk of death. It's a very small risk of death. Well, it's the same for having textured implants in. But for some reason, I think we find it easier to accept the risk when we go skiing, or when we go drive in a car, or if we drink, or if we smoke, or if we use sunbeds, or if we do anything really, to be honest with you, live, eat barbecue food, cross the road. Anyway, so yeah, there's risks with everything. So it's about putting it in perspective. But as I say, if it is obviously an emotive thing, and some people think, I don't want that, I want smooth. Fine, you can have smooth, but you have to accept that they were the original implants. They have got some limitations in terms of the lack of adherence with the tissues, increased risk of capsular contracture, more likely to move about. The good thing about them is that if they do move about, because they haven't really got as much structure textured silicone implant, it doesn't matter quite so much. You often don't notice it if it moves about, but obviously they can't come as a teardrop shape, but still, um, that's that's um, that's a balance. It's all a balance. Life is a, is a balance. It's not really a balance, but it's a, um, you know decision making decisions. Yeah. So I hope that's helped you make your decision. Smooth versus textured. I tried this the other day in a clinic with a patient, and I didn't do a very good job of it, to be quite frank with you. Talking about the risks of implants, and risk of dying in the car and things. It didn't go well. So I hope I did a better job there, but I'm reflecting on it. I'm trying to refine my technique when I talk to patients about relative risks. I don't want you to think that, there's a, you know, doom. I don't want to be a doom bringer. Doom bringer.